Hello, my name is Linda Griffiths. I'm the lead nurse for the North West, North Wales and the Isle of Man Congenital Heart Disease Network, and I'm delighted to be talking to you today on behalf of the British Adult Congenital Cardiac Nurse Association about how to accurately measure vital signs in patients with congenital heart disease. So measuring and recording vital signs is an essential step in assessing the clinical condition of your patient. And when done accurately, it helps to identify if a patient's condition has changed, and it ensures that the correct course of action is taken. And of course, this is of vital importance in patients with congenital heart disease. So this short presentation aims to equip you with the knowledge and skills that you need in order to perform these tasks accurately and safely. And it is mainly aimed at nursing staff, but it may also be useful for other allied healthcare practitioners. So at the end of this short presentation, you'll be able to accurately measure and record a patient's vital signs and understand why some patients with congenital heart disease have variations to what you would expect to be normal. It's also important to understand how to perform these tasks accurately in patients with congenital heart disease and to take into account their underlying anatomy and any previous surgeries that may have been performed. This may mean that you have to make some adjustments in order to get an accurate result. And knowing what's normal for your patient is crucial so that you're able to identify when their vital signs have changed and therefore to be able to act appropriately on that information. So the monitoring and measuring of vital signs are core essential skills for all healthcare practitioners. So we expect therefore that you will already have undergone extensive training on how to accurately perform and record a heart rate, a blood pressure, a temperature and an oxygen saturation. And we're also going to assume that you've been trained to safely use the equipment that is available to you in your area of work. And therefore, this will not be covered in this short presentation today. So where do we start? So we start by getting as much information as we can to help us understand what's normal with the patient. Now, in order to find out what's normal, first thing to do is ask them directly. They can often tell you this information themselves. And if they're unable to do this for you, ask them if they've got a clinic letter with them, because sometimes this information is contained within it. Some patients may have information stored on an app on their phone, or they may actually hold their own medical records and be able to refer to that as well. And remember, if necessary, you can always contact the ACHD team responsible for their care, who will be able to provide you with more detailed clinical information. They'll be able to provide you with some context and background information that you'll find helpful as well. And don't forget to speak to their family or carers if they're with them and if you have permission to, because they often have important context and information to help you understand what's normal for the patient as well. And it's really important to be mindful that if the patient or their family and carers are telling you that they're worried that something's not right, to be mindful to take note of that, because patients themselves tend to know when things aren't right. So why is it important to record vital signs? Well, recording accurate vital signs will provide a baseline from which changes in the patient's condition can be monitored. Sequential assessments of vital signs are used to screen for signs of serious illness or deterioration. It helps to measure success of treatment, and it provides you with a trend of how a patient's illness is progressing. And more frequent and rigorous monitoring is required for those patients where you're worried that they have a serious illness or you're worried that they're at an increased risk of deterioration. So validated early warning scores are used in most hospital settings across the UK, and they're useful because they aid individual and team awareness of patients who may be at risk of deterioration. This is helpful for all patients, but it's useful in the context of congenital heart disease as well. However, the early warning score may not identify all patients at risk of deterioration. Now, that might be due to the speed of the deterioration, or it may be due to the mechanism of that deterioration. So it's really important that all staff are able to recognise common patterns of deterioration with or without that early warning score. And it's important to not just rely on the score alone for reassurance either. Now, some patients with congenital heart disease have abnormal vital signs that may be entirely normal for them. So for instance, patients with cyanotic congenital heart disease will have low oxygen saturations normally, and they may be as low as in the 70s or 80s, and it may be completely normal for them. So this is one of the reasons why it's really important to understand what is normal for your patient. It's also important that a senior member of the medical team or clinical team who understands what's normal for each patient is the person who is responsible for changing parameters within an early warning score. It's important to avoid repeated and inappropriate triggers that are at best an inconvenience for the patient and staff. But at worst, we need to make sure that we don't cause inappropriate treatment to be delivered to a patient based on the early warning score alone. So it's important to recognise when the complexity of clinical decisions requires specialist knowledge and expertise, and that you know how and who to refer to. It's helpful to use a structured communication tool such as SBAR. Now that's useful to convey critical information to senior nursing or medical staff. And using an SBAR will help you to be able to describe the situation that you're faced with, be able to give some background information that gives some context to that. You should be able to describe the outcome of your assessment so far, and also be able to recommend that your patient is reviewed appropriately. So in the first instance, you should know how to escalate your concerns within your own department, but also remember that there is always an ACHD team available for advice should you need it. So it's important that you know how to contact your adult congenital heart team, that you know who they are and how to contact them. So if you're not sure who this is, then your regional congenital heart network will be able to provide this information for you. So if we have a little look at blood pressure first. So blood pressure recording is important, and it's important that it's done accurately. And many things can make a blood pressure rise for a short time. So make sure the patient doesn't need to use the toilet, that they've not just eaten a big meal. Try not to measure their blood pressure within 30 minutes of drinking caffeine or smoking, or immediately after exercise or drinking alcohol. Now, if this isn't possible or practical, then make sure that information is recorded alongside the results of the blood pressure. It's helpful if the patient is wearing loose fitting clothes, like a short sleeve t-shirt is ideal, where you can push the sleeve up comfortably. If that's not possible, then offer them a gown to wear so that you can do the blood pressure accurately. Now, if there are no gowns or the patient doesn't want to, then just make sure that this information is also recorded so that it can be taken into consideration when interpreting the results. Always use the same arm for recording the blood pressure, as each arm will give you a slightly different reading sometimes. And you may find that the patient will tell you which arm they normally have their blood pressure taken in, and you should take note of this and listen to what the patient is telling you. So before you take the blood pressure, allow the patient to rest for a few minutes. They should be sitting down with their arm resting, their palm up on a firm surface, and their feet flat on the floor if possible. Make sure their arm is supported and that the cuff around their arm is at the same level as the heart, and you may need to use a pillow in order to ensure that it's at the correct height. And their arm should be relaxed and not tensed. Make sure you use the correct sized cuff around the upper arm using the recommended guidance from the device that you're using, and be mindful of the fact that some of our congenital heart patients are quite small, and you may even need to use paediatric equipment. The bladder must be positioned accurately over the artery from which the blood pressure will be taken. And remember, if the patient is in atrial fibrillation, you should not use an automated machine to record the blood pressure. It won't give you an accurate result in this setting, and instead a manual blood pressure recording should be taken using a handheld machine and a stethoscope. So if we have a look at blood pressure in the context of congenital heart disease in a bit more detail, it's very important in patients with congenital heart disease that you're careful to do the blood pressure in the correct arm. So doing it in the wrong arm may result in an inaccurate result. So the picture circled over here is a picture of a condition called tetralogy of Fallot. This results in a narrowed outflow tract here on the right-hand side of the heart, causing a reduced blood flow to the lungs. And babies born with this condition appear cyanosed as a result. And if the blood supply to the lungs is severely affected, then they may have had an operation called a Blalock-Taussig or a BT shunt, which is pictured over here. And that will have been performed in infancy. And the very early attempts at this operation use the subclavian artery to create this shunt. And when the subclavian artery has been used, this is referred to as a classical BT shunt. Patients who've had a BT shunt will have a scar under the arm on the side that it's been done, and they'll often know that their blood pressure and pulse is hard to find in that arm. So remember, a BT shunt can be performed for lots of different reasons, not just in tetralogy of Fallot. So it's important to check. And if a patient has had a BT shunt, especially if it's a classical BT shunt, you should avoid doing a blood pressure, heart rate, and oxygen saturation in the same side as where they've had their BT shunt, as you may get an unreliable result. Another condition that is important to be mindful of is a condition called coarctation of the aorta. This is where there is a narrowing in the aorta, usually at or beyond the site of the ductus arteriosus, which is this tiny structure here. Patients who've had a subclavian flap repair, shown in the picture here, will have abnormally weak left radial pulses, and this is because the subclavian artery is being used to create the flap to widen the narrowing. The left arm blood pressure will therefore be artificially low and unreliable. And if patients have developed a recoarctation or a restenosis, this can also be reflected in the blood pressure in the left arm. So it's recommended that all patients with coarctation of the aorta should have their blood pressure recorded in the right arm only to ensure an accurate result. Now, sometimes you might be asked to do a right arm and a right leg blood pressure, or you may be asked to do a blood pressure in all 4 limbs. So in order to do a blood pressure in the leg, it's really important that the patient is able to lie down on a bed. They shouldn't be sitting in a chair with their legs in a dependent position. Of course, if they're wearing tight clothes, offer them a gown to wear. And it's important to select the correct blood pressure cuff size in the same way as you would do when you're doing a blood pressure in the arm. Patient needs to be relaxed and comfortable and should be asked to bend their knee slightly with their foot rested comfortably on the bed. And the cuff you should make sure that the cuff is at the heart level in the same way as when you do a blood pressure in the arm as well. It's important that the cuff is placed accurately on the leg with the bladder positioned in line with the popliteal artery at the back of the knee here, as you can see, or in line with the posterior tibial artery here in the ankle. It's important to warn the patient that the cuff can feel quite uncomfortable when it's inflated on the lower limb, just to make them aware so that they can try and stay calm during the procedure. And it's important to record the blood pressure accurately, and you're going to need to identify which limb you've done the blood pressure in. So a right arm and a right leg blood pressure are useful. They're useful to understand whether there is any significant coarctation or restenosis following a previous repair. So if the blood pressure in the leg is greater than 20 millimeters of mercury lower than the blood pressure in the arm, then this may indicate that further investigations should be performed to assess the narrowing further. So we have a little look at oxygen saturations now. So an accurate oxygen saturation is an important assessment of the patient with congenital heart disease and needs to be performed well. So try and ensure that the chosen site is warm and well perfused. Apply the probe to the site, ensuring the sensor is correctly positioned with the light source at the top. Ask the patient to rest the hand with the sensor on it so that movement doesn't interfere with the result. Check the pulse strength signal and ensure that the pulse rate reading correlates with a manual pulse, and you may need to leave the oximeter in place for several minutes to ensure that it's picking up a good signal. Document the reading, noting whether the patient is breathing room air or oxygen, and if the patient is receiving oxygen therapy, record the delivery device used and the flow rate or percentage of oxygen that's being administered. It's important to note other factors as well that may influence accuracy of the results, such as movement. Do they have cold hands? Are they wearing nail varnish that should have been removed? Clubbing of the fingers, such as in the picture here. And where oxygen saturation monitoring is indicated, then a respiratory assessment and measurement of the respiratory rate should be performed at the same time to give you a complete picture. And where a good signal is obtained, pulse oximetry readings are accurate as long as the saturation range remains between 70 and 100%. But results cannot be relied on to be accurate outside of that range. So in acute illness, resting saturations are useful, but we do also measure oxygen saturations during exercise testing, sometimes to determine exertional desaturation that may in fact indicate a right to left shunt or a bidirectional shunt. It's quite often performed as part of a 6-minute walk test as well in patients with pulmonary arterial hypertension. So it's important to record whether the readings have been taken at rest, during or after activity, and in addition, whether they were breathing room air or inspired oxygen. So a little bit about differential cyanosis. So during fetal life, the patent ductus arteriosus is a blood vessel connecting the left pulmonary artery to the descending aorta here. Now this normally closes spontaneously soon after birth, but if this doesn't happen, and if it's a large ductus arteriosus that's not been corrected in childhood, it can initially create a large left to right shunt. Now this means that systemic or oxygenated blood will be shunting through the duct into the lung arteries in this direction. Now the lung arteries are a low pressure system, so over time these lung arteries will become damaged as a direct result of being exposed to that high pressure flow over many years. And in rare cases, the patient can develop severe pulmonary arterial hypertension and go on to develop a condition called Eisenmenger syndrome. Now, when this happens, the blood pressure in the lung arteries here is so elevated that it allows the blood to shunt through the duct in the opposite direction, so in this direction here. And this is now a right to left shunt, and this will result in deoxygenated blood being shunted down the aorta to the lower extremities. So patients with this condition will have normal oxygen saturations in the upper limbs, but they may have profound cyanosis and clubbing in the lower limbs. And this is called differential cyanosis. So you may on occasion be asked to check the oxygen saturations in the feet as well as the hands. And remember, it might be normal for that patient. So if we think about heart rate, it's important that the heart rate is checked after allowing a patient time to rest. And it should be taken at the radial site in the wrist by palpating the artery using the first and second fingertips, pressing firmly on the site until a pulse is felt. But remember to be mindful of only using the right arm to check a pulse in someone with coarctation of the aorta, as described earlier on in the presentation. And obviously, if the patient has had a classical BT shunt in the past, you should avoid assessing the patient's pulse in the same arm as the BT shunt. It is okay to check the heart rate using a stethoscope to auscultate the apex heart rate if required, but it shouldn't replace checking the heart rate manually. Checking manually allows you to check not only the heart rate, but also the characteristics of the pulse. So you can check whether it's full and bounding or whether it's weak and thready. And it also helps to establish whether the heart rate is regular or irregular. And it's important to count the heart rate for 1 full minute, noting the rate, the depth, and the rhythm. So if we have a little look at respiratory rate now, once again, it's really important that the patient is given time to rest. So if they've just walked from the car park into your department, they're going to need time to recover before you begin to assess them. And remember, a normal respiratory pattern is an easy, relaxed, subconscious activity. And also be mindful of the fact that some patients may have normal low oxygen levels. So it's important to know this when you're performing your assessment. It's important to assess the pattern, the effort, and the rate of breathing, and to make sure that you record everything accurately. But in addition, also note their colour, their skin colour. Do they look pale? Are they mottled? Are they sweaty? Do they look more cyanosed? Are they more cyanosed than normal? Look for signs of respiratory distress. Are there noises that you can hear that don't sound normal, like a wheeze? Do they appear breathless? Are they coughing? Check to see if they're using increased effort to breathe, and also note the shape and how the chest is moving. And your findings should be clearly documented. And remember, just like the heart rate, a respiratory rate should be counted for that full minute. So when we think about temperature, some cyanosed patients and patients with heart failure may complain of feeling cold or have cold extremities. Now, you may need to give them time to warm up if they've come from outside. But I guess the big thing to be mindful of here is that the risk of endocarditis is elevated in this group of patients with congenital heart disease. So if you have a patient with a temperature of over 38 degrees and there's no obvious cause for that temperature, then you need to have a very low threshold for thinking about endocarditis and taking steps to rule it out. So a small but significant group of patients with congenital heart disease also have a form of special needs or learning disabilities. Now this means that an individual assessment will need to be done working with the patient, their family, their carers. You may need to involve their learning disability team, and you may even need a psychologist. They may need individual adjustments to be made in order for them to successfully have their vital signs recorded. They may have a health needs assessment in place, and they should have a disability health passport that will help you understand how best to approach the person and what's important for them. So it's important to work with and alongside their family and carers to understand what approach to take. And remember, this may take several attempts, and it may require a huge amount of patience. You may need to employ distraction techniques for some patients, and for those with autism and ADHD, they may need to come back to clinic at a completely different time when the department is very quiet and to not be left waiting around. So each patient will need to be assessed on an individual basis, but the time spent getting this right will be very rewarding for you as a healthcare practitioner, and it will be massively important for the patient themselves to have a really positive experience. So remember, repaired does not mean normal or fixed, either structurally or physiologically. You might not know what all of the different operations are and what their importance is. So a common sense and a cautious approach is really helpful. And remember, the patient may know much more about their condition than you, so do be prepared to listen to them. And if you come across a congenital heart patient, use that opportunity to learn. And if you're around when the congenital heart team are around, use that opportunity to ask them questions as well. So in summary, take the opportunity to try to understand your patient's underlying congenital heart defect. This will help you understand the relevance of altered clinical observations. Know what's normal for your patient and be prepared to listen to them. Remember the special considerations that need to be made for patients with BT shunts and coarctation of the aorta. And remember, you may need to make certain adjustments for patients with learning disabilities in order to get an accurate assessment done. And have a low threshold for seeking expert help, and know how to contact your adult congenital heart team. So thank you for completing this short presentation today on how to safely measure vital signs in someone with congenital heart disease. Take some time to reflect on what you've learned and how this may impact your clinical practice. You may wish to contact your ACHD team to see what other learning opportunities are available. And if you wish to receive a certificate to confirm that you've completed this today, then if you complete the online evaluation that's linked to this talk, then a certificate will be sent out to you. Thank you.